How are you?
Good morning, Dr. Zahn. Yesterday, after work, I was driving home, and the car in front of me slammed on the brakes to avoid hitting a dog, and I had to slam on my brakes to avoid hitting the car. And I was thrown forward, and then the seatbelt protected me from going any forward, and then I was whipped back in the seat, and I got up this morning, and I think I have whiplash. I have a lot of neck pain. I can't seem to rotate my head right and left, and I have pain on this side of my rib cage. Dr. Lee, can you help me?
Yes, I think according to the symptoms and the motion you have, I think it's probably the soft tissue, ligaments, and muscles have some bruise or injuries. And plus, you had neck pain before, and those soft tissue injury can aggravate the neck pain. So typically people will go to PT and try to do exercise, which I think is not the right time now because you have some soft tissue damage. You need to repair those tissue. There's a swelling inside. There's a bruises, right?
It feels like it, yeah.
So when the soft tissue were injured, and we need to reduce the swelling, stop the pain first. So if there is a pain, that means there is inflammation. So if the inflammation is not going away, then the swelling continues. You will have more scar tissue, either around the neck or around your rib cage. And in the future, the motion range of your neck will be limited. So acupuncture is very safe treatment for the neck because there are so many nerves going through the spinal canal and coming out from the spine and going through your head and going to the different organs. So when you have injury here, you not only have local pain, but some people have dizziness, some people have heart issues, anxiety, depression.
I have some dizziness, and if I try and turn my head way over to address you, it's painful. I don't have that same motion that I used to be able to swing my head right and left. Is it good to move it, or at this stage, don't move it?
I think a gentle movement would help the circulation and the muscle, because if the muscle get tighter, and then it irritates the nerves, and also if you don't move, your circulation will be compromised. So you don't want to do big movement to aggravate the pain or making more swelling. But gentle movement without aggravating the pain would be the right thing to do.
So would this be categorized as a whiplash injury?
Yes. I think you look up the whiplash definition, right?
Right. Right. And how do I develop scar tissue in that area if I've never had any surgery? I can develop scar tissue even from a non-surgical.
Exactly, yeah. Because when you had soft tissue injury, for instance, in this rib cage, when you have the seat belt kind of rubbing your rib cage, and then you actually breaking up the small capillaries, the blood vessels, and so there's a swelling there, and your muscle is injured slightly, and those muscles can be repaired. But if it cannot be repaired as soon as possible, and then there will be scar tissue there building up, and that will restrict your motion range in the future.
Well, that seatbelt prevented me from putting my body against the steering wheel and probably causing more damage.
Yes, exactly. We call that seatbelt. It can save our life, but can cause a little bruise somewhere.
Mm-hmm.
So acupuncture is a very safe treatment, and the differences between natural recovering and using acupuncture to help you recover is that with acupuncture treatment, you recover faster because your circulation gets better. The repairment of the muscle is faster. You have less swelling, less scarring. So when you reach 90 years old, you have more reserve in your neck muscle to do more motion range.